Hello everybody, my name is Dr. Vince Gutierrez. I'm a physical therapist. You can find me at movementthinker.org. I practice out of the Joliet, Illinois area. So in all the previous videos, we've covered introductions. What do you do for a living? What do you do in your free time? Describe your symptoms to me. When did your symptoms start? Are they changing? Better, worse, or the same? Are your symptoms constant or do they come and go? What makes them better? What makes them worse? How does time of day affect your symptoms? Are you waking up at night? What position are you sleeping in? And how firm is your surface? Done. Next, the stuff that we're going to cover, it's needed, right? Is this the first time that you've ever had back pain? If yes, you're a rarity, right? I mean, at some point, you always have to have your first, right? You always have to have your first, but there's a high recurrence rate of back pain, and so we know that if you have it once, you have a higher likelihood of having it again. I covered a little bit of the research on it, but the research is kind of skewed, right? The older research said that you had an 80% chance of having your back pain recur, and that research was flawed, and the newer research is saying there's only a 25% chance of having your back pain recur, right? But the difference between 80 and 25 is huge. There's a 50 point difference in there, so that's kind of big. And so when I went back and looked at the two different research studies to try to figure out where is this discrepancy coming from, in that research study that said that there were 80% that had their symptoms recur, that they didn't really define recur. And the problem is that there may have been a large percentage of those patients that had back pain here, and when they went back and checked on them way later, they still had the same back pain. So it's not that you have an 80% recurrence rate, it's just that you might have a 50% of patients that just didn't get any better, right? And that's not cool either, because you're getting treatment to try to get better. So yeah, it looks like 25% recurrence rate. And so we want to know how many episodes of back pain have you had throughout your life, so keep track, start counting now, tab the wall. And every time that you get back pain, tab the wall. I mean, I tab it a lot. I've got a major history of sciatica, but it's not about me, right? It's about you. So we want to know how many episodes that you've had, because the natural history of back pain, when you look at some of the research, says that your episodes may actually worsen over the course of time. And so we want to know when you first had your back pain, how many years ago, and what did it start as? And then now that you're getting these episodes currently, what do they look like? We also want to know what type of treatment that you've had in the past, right? That should be an obvious question. Unfortunately, it gets overlooked by some practitioners. So if you went into therapy and you were there for 20 visits, or you were there for 6 months, I mean, it happens, I hate to say it like that, and you're still having symptoms, just tell me what they did. And, please don't tell me that they gave you a little clipboard and had you check off the stuff that you were doing. If they did, that's fine, tell me. But if they did that, that really sucks, because therapy's not cheap, and you just paid for a home exercise program in the clinic, and that's not cool either. That's really not cool. You shouldn't be doing that. If you're doing that, find another therapist today. Go leave your clinic and never go back. Don't even answer their calls. Just leave and go find another clinic. God, therapists are going to hate me when they watch these videos. Moving on. What did they do in the clinic? And did it help or did it not help? And so there are some things that have very little evidence behind them for helping, right? But some patients, they help. Because not all pain is related to a structural issue. And some patients really believe that they help. And if that's the case, that's fine. And I might go back and do those things if you really believe that they help. If we can find a way to help you without me doing things to you, then we're going to try that too. But it's okay for you to have an ultrasound. It's okay for you to have an e-stim. There's some therapists that are just highly opposed to it. I understand where they're coming from. But if you believe that it really helped you, and I may need to do that to get you to buy into my treatment, then I'm okay with doing that for a short period of time. Next, coughing, sneezing, straining. Does any of that have any effect on your symptoms? And when you do that, you build up pressure in your belly and in your chest, right? To release. Oh, that was probably loud on this thing. Sorry. To release that pressure. And so when you build up pressure, that may cause symptoms. It may not cause symptoms. That's fine. It's again, at this point in time, it's just data. We're collecting as much as we can. Do you have any bowel or bladder issues? Now, this is a rough one for me, because sometimes I'll ask that question, and if there's any hesitation on the part of the patient, I ask the question differently. So, do you have any trouble peeing or pooping? Right? I try to bring it down to a very basic understanding level because this question is very important, right? In my career, I have seen three patients, off the top of my head, three patients that have experienced what's called cauda equina. And that's another one of those, those red stop signs for us. And when we see that, that patient needs to go to the emergency department today, right now. We stopped the eval. Everything stopped. We're going. All right. And I've had that happen to where these patients have gone in for emergency surgery. Because if there are some issues with bladder where you can't get it all out, right? That's saying that some of the nerves may be affected that go to that area. Well, you don't want nerves affected that go to that area, right? I mean, you don't want urine building up. One of the other possibilities is, you can lose control of your bowels. Another one, not very good. This stuff needs to be caught, right? And so this is we send you out immediately because you don't belong in my clinic yet. And we just have to make sure that there's nothing major going on before we bring you back in to finish this evaluation. If we bring you back in to finish this evaluation, like I said, I've had a couple of patients, and one, man, he was so grateful. He wasn't able to urinate, and he was catheterizing, and he got emergency surgery, and he peed on his own without help. He was so grateful. He came back to say thank you. So it's really good to hear stories like that. But yeah, so every once in a while we will send you out of the clinic to go get help. Okay, so but again, that's a big question that your therapist, if there's any hesitation on your part, your therapist should be jumping right back in to try to understand why you're hesitating. If you're hesitating because you don't understand the question, then your therapist should be re-asking that question. If you're hesitating because it's embarrassing and you don't want to admit to having some sort of incontinence, please admit it, right? We go to school for so long, you're not the first person who told us that you leak. Okay, that's fine. There's treatment for that too. I recommend a few therapists out in Chicago. Sandy Hilton, she's really good. She'll get a shout out on here. That's fine. Sandy, thank me later. Anyway, no, Sandy's really good at this. So the incontinence is not something to be ashamed of. Some people have it and there's treatment for it, and you can go see somebody who does that. I don't do it right now. Don't know if I ever will, but I definitely don't do it right now. One of the other things that we look for is how do you walk? Are you staggering? Is your walking so bad that I would think you're drunk? This is another one of those red stop signs, right? We would send you out of the clinic. Are you dragging your feet at all? That's another one those possible red stop sign. We might send you right back out of the clinic. But there are some cases that just don't belong in the clinic with us, and they need to be seen by, a surgeon, a neurologist, an orthopedist, your primary care physician, somebody other than me who can try to figure out why you have a funky gait or a bowel or bladder or a poop and pee problem, right? So you do need to see somebody who specializes in those type of issues. All right, so it's been 7 minutes. I'm going to stop there. Thanks for watching.